You want single payer?
Yes.
Yeah. Single payer option.
Yes.
Let's go to Canada. Let's check Canada out.
Grown up in Canada and knowing that system and looking at this from a global perspective, show me one example somewhere in the world that is a free market health insurance, healthcare system.
Nowhere on the face of the earth is there a free health insurance market that works. If you could point me to one and say that a free market works, it's just one of those areas that a free market doesn't work. You know, sir, that in all those countries, all the developed countries that have single-payer systems or universal health care, happiness about health care is actually substantially greater than it is in the United States.
Then why do they all come here? Why do they all come here for treatment?
They don't all come here. You Republicans say that all the time. They don't all come here. They don't all come here. People in Canada, people in Norway, people in the United Kingdom, people in Sweden, people in Denmark, they don't all come to the United States for health care. Why do you say that?
Well, because you see it all the time. People in Canada come here for extensive surgery. They come here and get it done in the United States.
Sir, I grew up in Canada. I live in Canada. My entire family's in Canada. Nobody I know ever came to the United States for health care. I'm sure you have a handful of stories about things like that. It's not actually statistically true.
Yeah, well, you think Obamacare is great? You think the idea that
No, I'm absolutely not saying that. I'm not arguing Obamacare. I'm arguing the fact that you keep on saying that a free market works.
But
just name me one country. Afterward on Twitter and anecdotally I checked to say, am I out of touch because I've been living in the United States for a while? And everybody told me the same thing. No. There are dotting the Canadian-U.S. border in places in Washington State and Michigan and upstate New York. There are MRI clinics, X-ray clinics, things like that, where if you don't want to wait to get your MRI and you're prepared to pay cash for it, you can do that. There's no real medical care that Canadians are coming to the United States for. And certainly when it comes to prescription health, it's the other way around. Americans go to Canada, either online or physically, to get their drugs.
Go to Canada. Canada has basically more. If you abuse it, you lose it. You lose health care in Canada if you abuse it. So make no mistake, it's not free. That means you have to show good stewardship. You have to go to your preventive classes. You have to keep yourself in a healthier lifestyle. Then you just can't have any MRI every time you walk in. You can't get all the stuff you can here. There's ration. They do ration.
You can't get an MRI anytime you want here either.
Well, let me just tell you what's
Unless you have money. I've been waiting months to get an MRI, and I can't get one.
Yeah.
One country in the world where a free market system for health care works.
We just had an election in last November where this was a huge issue, and we told the American people what we were going to do, and we said we were going to repeal it. We didn't say we were going to repeal it and take the Medicaid expansion and extend it. We said we were going to repeal it. We didn't say we were going to repeal it and keep a bunch of the Obamacare taxes. We said we were going to repeal it.
Okay.
So let's repeal it.
I'm a business guy. I'm a capitalist. If you could show me a system where this actually works, an unadulterated free market system where the market handles it all, I would embrace it. But this is what we in business call a market failure.
Exactly.
Worldwide, it has never actually worked. Unless there's someone forcing everybody to get insurance, the private markets won't do it on their own.
Yeah, and even historically, free market economists have agreed that there are places where the market fails, and in those places you need interventions.
Often prisons, hospitals, and healthcare.
Education, public education. There are areas where if we left it to the market, too many people would be left out of a necessary public good. This is one of those.
I would love it if next time we talk, you had some statistics on any plan anywhere that is an entire free market system that works anywhere in the world.
I just talked about Medicaid. I just talked about it. I didn't say a complete free market.
Medicaid's a government program, sir. You can't talk about that as a free market system. It's a government program.
No, I know.
Can't insult the government all show and then say you really like Medicaid.
I didn't say that either. I said there's a need for Medicaid for the disabled and the traditional populations that it is served. I understand that. But I don't think we should be expanding and saying, oh, putting more people on a Medicaid program is better than bringing back affordable insurance that meets their needs.
At least I got you to admit you sort of like government. Congressman, good to see you. Thank you for joining me.
Good to be with you, brother.
There's not on this planet, there's no actual free market health system. And that's because no profit-making company would ever choose to willingly insure a sick person or an old person. They just don't do it. So the only way this works is as a risk pool. Now, the only way to cover as many people as you can with a risk pool is to do what most countries, most modern countries have done, and that is a single-payer healthcare system or a fully mandated system, not even Obamacare, one where it's not a penalty. Everybody has to pay into it. That's the only way you get young, healthy people to buy into a system that's actually relatively expensive. And over time, it all evens out. I'm not arguing that single-payer healthcare systems solve all problems. They certainly don't. But in all of those countries that I named in that clip, outcomes are better. Life expectancy is longer. Preventative health care is a bigger deal, but preventative health care doesn't work in our insurance model. We pay for services rendered. There's no rush for people to come to America where health care costs twice as much per person as anywhere else in the developed world.
If health care is done and done right, you can live a healthier, more productive, longer life, and a cheaper life for all of us. I know that. The bottom line is, how do we get this change to that, a capitalist society, a capitalist economy, to change part of it to a socialist, basically, and that's what it is, and that's fine. But we got to work through it. You all got to keep speaking up. Bernie and I get along fine. I know Bernie well, and we talk a lot in our debate, but we do. We agree on the same problems. We just disagree on the solutions.
Single payer option.